Welcome to the following Parenting Special Needs Magazine podcast. I'm Shantae, the founder and publisher of Parenting Special Needs Magazine. We created this podcast to uplift, educate, and celebrate you. We're so glad you're here, so let's get started.
Hello there. My name is Corrine Jones, and I am one of the co-leaders of the Special Needs School Nurse Interest Group of the National Association for School Nurses. We are a subgroup within the National Association of School Nurses that specifically works to support our fellow school nurses with resources such as healthcare planning, sharing advice, answering questions, and problem solving in caring for our students with chronic or complex health needs in the school setting. We do things like organize presentations at our annual national conference each summer. We put on a presentation at least annually via the internet for our members, and we host an online forum for our members to engage and connect. This past fall, we put together an online presentation on ways to support attendance in our students with chronic health needs. A little bit about me. I've been a nurse for over 30 years now, which really dates me. I spent most of my career in the hospital, primarily as a pediatric ICU nurse at Chicago's largest children's hospital. I loved hospital nursing. All of the adrenaline and excitement of the PICU, the care of critically ill children, and really feeling like you are making a difference in the lives of these children and their families was something that I loved. I actually fell into school nursing probably the same way a lot of other school nurses do. I had children and I needed to be on their same school schedule. However, I very quickly came to appreciate the breadth and depth of the work of a school nurse. It is definitely not just Band-Aids and ice packs like people may think. We don't just take care of a patient or student for the few days they are in the hospital. They are our patient, oftentimes for years. We might care for a student from kindergarten all the way through 8th grade, depending on the makeup of our school. This really allows us to build a strong relationship with both the child and the family. I've really seen the impact we can make by the relationships and the communities we build. One of the most important aspects of school nursing is regular and open communication between parents and school nurses. This really fosters consistency in your child's care while they are at school. When you first enroll your child in school and you turn in their physical and immunization record, if your child has any health concerns, please call your school nurse directly. We want to hear from you. We want to hear about your child and their needs. Every single child is different. They have different health needs. They respond differently in the classroom. No two children have the same asthma symptoms or reactions to an accidental allergen exposure. No two headaches are alike. We want to know your child, and you are the person who knows them the best. When parents and school nurses collaborate, we can develop and implement individualized healthcare plans and emergency action plans, if needed, tailored to your child's specific healthcare needs. Only the parents can provide critical information about your child's medical history, medication regimen, or any specifics, such as cold weather, illness, or any activity that may trigger an asthma exacerbation, or typical daily health routines for your child. As school nurses, we use this information to monitor your child's condition throughout the year, and we work with your child's teacher and their school schedule as much as possible to administer medications, or schedule any necessary health procedures around core subjects, for example. Knowing your child's baseline helps us to respond quickly during emergencies. We can educate the child's teacher about your child's specific health needs and any signs and symptoms that a student may be in distress or needs to be evaluated by the nurse. A well-structured partnership and collaboration between home and school ensures that students receive appropriate care, reducing the risk of health complications while at school. We hope that as parents, you inform the school nurse about any changes in your child's condition, medication adjustments, or new symptoms. The school nurse can then watch for any possible side effects and communicate that with you at home. When you really think about it, kids spend 50% of their waking hours at school. That is a lot of their day, a lot of time that we are with them at school. So the more we know about their health, the more we can properly care for them and keep them safe. Similarly, the school nurse can keep parents updated on their child's health status during school hours, including any incidents, symptoms, or concerns observed. Say your child started a new stimulant medication and you are concerned about appetite suppression. We can communicate with you if they are eating their lunch, or see if they need extra snacks during the school day, for example. This ongoing dialogue ensures that parents and school staff remain aligned in managing your child's health, promoting stability and confidence in both settings. This strong partnership between parents and the school nurse strengthens the overall school-home connection, reinforcing the idea that education and health go hand in hand. When families and the school nurse collaborate effectively, we are creating an environment that prioritizes both that academic achievement and student health and well-being. A child with a chronic health condition may also experience anxiety or fear about their condition while at school. They can fear embarrassment or bullying about their condition or being different. Especially in adolescence, no child likes to be singled out or seen as different. Knowing that their parents and the school nurse are working together to support them and come up with an appropriate, safe plan in the school setting can alleviate stress and foster confidence. As a child gets older, they can be involved in their health planning in age-appropriate ways. With a clear health plan in place, students can focus more on their education and social interactions rather than worrying about their medical needs. And as students get older, the school nurse helps them learn to manage their own health conditions with guidance from parents and healthcare providers. We can help teach students age-appropriate self-care skills, such as recognizing symptoms, taking medications correctly, and seeking help when needed. Parents and school nurses can work together to gradually empower students to become advocates for their own health, preparing them for greater independence as they transition toward adulthood. For example, if a student takes daily medication, we develop ways to help the student remember to come to the health office daily on their own to take their medication. And as they get older, we are introducing those 5 rights of medication to the student in age-appropriate ways. We help them learn to recognize how they feel if they forget to take their medication, and so forth. We don't expect a student to manage their health condition on their own, and we don't do any of this without a parent's involvement. But we partner with parents to help students learn to manage their health conditions independently in age-appropriate ways. The school nurse also plays a vital role in educating pertinent school staff in recognizing that a student may be experiencing an emergency and require the care of the nurse. We review the student's emergency action plan with the teacher if necessary and make sure the teacher knows the immediate steps to take in an emergency. We can also work with the student's classmates regarding the child's condition, ensuring a supportive and inclusive environment. This is obviously balanced by respect for the parent and student comfort level for privacy. Many school nurses have led classroom discussions about acceptance and inclusivity, even if they are not addressing a specific health condition or referring to a student directly. Managing a student's health gives the teacher time to focus on actually educating the children in the classroom because we are keeping them healthy and in school. Mental health symptoms have been on the rise since COVID-19, and the school nurse can be one of the first people to recognize that a student may be struggling with symptoms of anxiety or depression in the school day. Frequent health office visits and somatic complaints, especially when there is no direct health correlation, are 2 signs a student may be experiencing a mental health concern. Some of my graduate research was on this topic, and one of the studies used in that literature review noted that school nurses spend approximately 33% of their time addressing student mental health concerns in their health office. While we cannot diagnose, we can communicate with parents or refer students and their parents to higher level supports within the school, such as the social worker, the school counselor or psychologist, or even medical support in the greater community if needed. We may even just be that friendly face or reassuring support person your child needs. Beyond the chronic health conditions we've been mentioning, the health needs of students have become more complex over the years. With advances in medical care, changes in educational law such as IDEA and FAPE, healthcare in schools has become significantly more complex. We are changing the perception of competency and bias that a student's medical need does not equal cognition. There are students with tracheostomy that are ventilator dependent, requiring gastrostomy feedings, students with seizure disorders, catheters, central venous ports, or undergoing significant medical treatment during the school day. More and more students need access to a school nurse in order to safely attend school. That school nurse enables these students with complex health needs to attend school with their same aged peers in their local school, in their neighborhood. This is a particular passion of mine and something I have devoted a lot of my energy and focus into, teaching educational classes for nurses and caregivers around the state. So we've been talking about all of the ways the school nurse works in our health office clinic. And yes, we are responsible for managing student health needs, providing first aid, direct medical care, and supporting a safe learning environment. On a typical day, we assess and treat minor illnesses and injuries. We manage chronic conditions such as asthma or diabetes. We administer daily medications, track student immunizations, and maintain state compliance. We conduct vision and hearing screenings to ensure a student can see and hear adequately. We develop healthcare plans. We educate teachers on the signs and symptoms of an emergency response, and we also educate students on basic health and wellness. School nurses provide education on hand washing, basic hygiene, dental habits, healthy eating and exercise, bike health and safety, and many, many other topics. But school nurses do so much more than that. We are not in the health office every day just to provide health care. Our work also involves education, safety, and student academic support. School nurses are typically trained in pediatric and community health. A school nurse also helps reduce absenteeism. Ensuring that a child's healthcare needs are met supports attendance so that a student can actually be in school learning every day. School attendance is essential for academic success. Significant loss of learning time due to chronic absenteeism can really impact academic achievement and cause lifelong effects, such as school dropout, loss of future employment opportunities, or even long-term financial stability. Chronic absenteeism is typically defined as a student missing 10% or more of the school days within a school year for any reason, even if that is due to a known medical condition. There has been some recent research done within the last few years on school nurses and absenteeism. There was a study published last year in the Journal of the Public Library of Science. If anyone is interested in reading the full article, I have provided the reference links, so feel free to contact me. The authors of the article reviewed a large number of different academic research articles on the effectiveness of school nurses. They went back over about 20 years of research, 2002 to 2021. The authors discussed multiple studies, but in depth, 3 specific studies in 3 different states, New York, Tennessee, and Florida. The overall theme was that school nurses were shown to improve student attendance positively. The actual quote, and I wrote it down, was, "It is clear that school nurses play a key role in improving the health of children with asthma and diabetes, with particular emphasis in the areas of mental health or in low socioeconomic backgrounds." Looking at a common health condition like asthma, for example. Asthma affects about 10% of school-aged children in the U.S., with an even higher prevalence among low-income and minority populations. 60% of children experience an asthma exacerbation. There's studies out there, and I gathered some of this data from a task force compiled of members of the Allergy and Asthma Network, American Lung Association, and the National Association of School Nursing. Together, this task force did a study a few years ago, which showed that these asthma exacerbations led to approximately 767,000 emergency department visits and 74,000 hospitalizations annually. Compared with their peers, children with asthma miss more school days per year, totaling 13.8 million absences annually. This task force led to recommendations that quick relief medications, such as albuterol, should be stocked in every school to be used for children with or without an asthma diagnosis. So due to this initiative and the resultant stocking of undesignated rescue medication in schools, with assessment and administration by a school nurse, 79% of students were able to return to class after administration of albuterol. 20% went home with a parent, and only 2 students were transported to the hospital due to asthma exacerbations in school. That is a pretty incredible response. So I've been talking for a while about how fantastic school nursing is. I like to talk, and if you get me started on my favorite subject of school nursing, I could go on for a while. But it's very clear how school nursing supports our students and families. How we can support not only chronic and complex health needs in the school setting, but how school nursing can also impact absenteeism and ultimately student education. So federal law does not mandate a school nurse in every building. Neither does state law. Most states don't have a mandate or recommendation. And even if a state does have a recommendation, that does not mean school districts have to follow it. However, the CDC and the National School Nurse Association recommends at least 1 full-time nurse for every 750 healthy student populations. The National Association of School Nursing also recommends 1 school nurse for every 225 student populations requiring professional nursing care, 1 nurse for every 125 students with complex medical needs, and 1-to-1 nursing care for students requiring continuous nursing care. In 2021, NASN conducted a survey of school nurses and found that 65.7% of public schools had a full-time school nurse. A 2020 report compiled by the National Center for Education Statistics showed that in the 2015-16 school year, 52% of public schools had at least 1 full-time nurse, while 32% had at least 1 part-time school nurse. Elementary and middle schools were more likely to have a school nurse than high schools. Traditional public schools were more likely to have a nurse than charter schools. But sadly, schools where a larger percentage of students qualify for free or reduced meals are less likely to have a full or part-time nurse than schools where a smaller percentage of students qualify. Now think about that. This research says that school nurses were less likely to be in schools in low-income areas. Yet just a few minutes ago, we just looked at research that showed us that asthma, which already affects 10% of the population of our children, has an even higher prevalence among low-income and minority populations. And that is a population that is less likely to have a nurse in their schools. So in areas that may benefit from a school nurse, they may be the least likely to have one. Furthermore, according to the National Survey for Children's Health, which was completed in 2020, 13.6 million children, or 18.5% in the U.S., had a severe chronic healthcare need. 1 in 4 of U.S. households, 24.8%, had one or more children with a special healthcare need. Yet despite these large numbers of health needs, making nurses a larger part of school staffing efforts is still difficult. Why is that? Many schools are fortunate to have a registered nurse in every building. A nurse trained to administer these life-saving, undesignated medications, trained in CPR, the use of AEDs, and emergency response. I happen to be fortunate enough to work in an urban area where 911 emergency brings an ambulance within 3 to 5 minutes. Other areas are not so lucky. What about those rural areas where it could take up to 20 minutes for an ambulance to reach them? Some schools share a nurse where the nurse travels between schools during the day to deliver medications or treatments. Or maybe they spend 1 day a week in certain schools in the district. Think about that. Your school can only have an emergency on Monday. That's when your nurse is there. Your school, your emergency should be on Tuesday when the nurse is there on Tuesday. Sounds silly, but that's how it's scheduled there. Of the schools that do have nurses, nurse-to-student ratios vary widely. In 2022, ratios ranged from 1 school nurse for every 500 students in Alabama and Vermont to 1 nurse per 3,000 students in Tennessee. Another major challenge is the nursing shortage. This is not specific to school nursing. Schools, hospitals, medical facilities, they're all struggling to find nurses amid a nationwide nursing shortage. Federal officials predict the shortage is going to continue through 2037. Then we always have to mention the pay. It is well known to be much lower than in the hospital. There's also the stigma of being a school nurse. Even amongst nurses, we can be looked down upon by our fellow nurses as not a real nurse, or only handing out Band-Aids and ice packs. When the reality is, we are often the only medical professional in the school building. So our assessment skills, our knowledge base, the variety of diagnoses, illnesses, and high acuity we treat every day is comparable to many of the other areas I have worked in. We have to work alone, and we rely on groups such as NASN and our neighboring schools and districts for support. We're managing high health needs of students every day in schools, treating kids with asthma, diabetes, epilepsy, and other health conditions. We have students on ventilators with tracheostomies coming to school every day. We consider every single child and every single health need of equal importance. If your school does not have a school nurse, what can you as parents do to encourage your school to employ a school nurse? Parents have played a significant role in advocating for school nurses in various ways across the country, from presenting to school boards, lobbying for funding, to testifying before legislative bodies. Oftentimes, a tragedy spurs communities into action. A child died in Philadelphia in 2014 because he suffered an emergency requiring CPR on a Wednesday, and the school only had a nurse on Thursdays and every other Friday. Philadelphia has also lost a child to asthma in 2013 in a school with no nurse, and then in 2018, multiple students died after a severe flu outbreak. Philadelphia parents demanded more full-time school nurses after the flu outbreak. Parent groups, such as school PTOs and the Parents United for Public Education, pushed for better staffing, arguing that schools without nurses put children at risk. Their efforts led to increased funding for nursing positions in the district. In 2019, Chicago Public Schools reduced the number of nurses due to budget cuts. Parents, along with the Chicago Teachers Union, protested, arguing that students with chronic illnesses were at risk. The outcry led to commitments from the city to hire more nurses. In Maine, a group of parents lobbied school officials to increase nursing staff after a student with diabetes experienced a medical emergency in 2019 due to the lack of a full-time nurse. Their advocacy helped secure funding for additional nursing hours. During the COVID-19 pandemic, school nursing really rose to the forefront as parents across the U.S. supported organizations like the National PTA, calling for federal and state funding to ensure schools had adequate nursing staff for health screenings, contact tracing, and student care. This contributed to the inclusion of school health funding in relief packages. In 2022, a student suffered an asthma attack with no nurse present. Parents in Austin, Texas petitioned for a full-time nurse in every school after this horrible accident. What's noticeable about all these examples is that it took an emergency or tragedy for change to happen. Having a school nurse in the building does not necessarily mean any of those situations could have been prevented, but we never do know what could have happened if a school nurse trained in emergency care would have been present. It would be wonderful to change the narrative and mandate that every school had a school nurse on site every single day to provide for the health and safety of students. Before an emergency happens, parents can engage directly with school administrators to emphasize the importance of having a full-time school nurse. Attending and speaking at school board meetings allows parents to publicly voice their concerns and advocate for the hiring of school nurses. Share your stories. Do your research. Your district is not going to provide data to parents on the number of health conditions in your district, but that has historically been found to be helpful for health services to provide the rationale to hire school nurses. Work with your current health services, your PTO, or parent groups, or utilize your local or national resources to raise awareness about the critical role of school nurses. Organize informational sessions, distribute literature, or use social media platforms to highlight how school nurses contribute to student health and academic success. Again, check out the National Association of School Nurses website, which provides resources that can help in these educational efforts. There are toolkits on their website, and most state school nurse associations provide resources as well. Despite their proven impact, many schools still face funding shortages that leave them without full-time nursing support. Investing in school nursing means investing in student success, school safety, and community well-being. School budgets are often cited as one of the reasons schools cannot afford full-time health services. But according to the Centers for Disease Control, every $1 spent on school nursing, society saves $2.20. These savings come from preventing costly emergency room visits and parents missing time at work to care for sick children. The health office in schools may be the first place some students go for health care, or it may be the only place they receive health care. School nursing is not just a healthcare service. It is a vital component of a successful educational system. Healthy students learn better, teachers teach more effectively, and schools operate more safely when a school nurse is present. Parents really play a pivotal role in ensuring that schools provide adequate nursing services, safeguarding their children's health and enhancing their educational experience. Parents are also crucial in partnering with the school nurse. Please establish a rapport and relationship with your school nurse. We are here to advocate for your child, to ensure they have the accommodations they need to remain safe and healthy in school. That timeless adage is true. You can't educate a child that isn't healthy, and if your child isn't healthy, they have a hard time being educated. Children with chronic health conditions require consistent and coordinated care to ensure their well-being and academic success. Conditions such as asthma, diabetes, epilepsy, severe allergies, and other long-term medical needs demand ongoing attention and management. The collaboration between parents and school nurses plays a crucial role in providing students with a safe, supportive, and effective learning environment. By working together, parents and school nurses can ensure proper health management, enhance communication, and improve the overall quality of life for children with chronic and complex health needs. Thank you for taking the time to talk with me today. By recognizing the who and why behind school nursing, we take a critical step toward a healthier, more successful future for all of our students.
Thank you all for being with us today. And in case no one has told you, you are doing a great job. Be good to you, and we'll talk to you soon.